Pituitary adenoma is a benign tumor of the anterior pituitary gland. The pituitary gland is a small gland, normally about the size of a pea, and it's located behind the eyes at the base of the brain.
Pituitary tumors or pituitary adenomas come to us in a couple different ways. One way, in terms of symptoms, is patients can have visual complaints. Typically, if the tumor gets big enough, it could put pressure on the nerves for vision, the optic nerves, and that can lead to blind spots or visual loss. So visual complaints are a common symptom of pituitary tumors. And in those circumstances, quite frequently, treating it because of those symptoms is going to be necessary. Another way that pituitary adenomas or pituitary tumors can come to our attention is that the pituitary tumor is producing hormones.
Pituitary adenoma is diagnosed based on imaging. The best imaging modality is generally an MRI scan. They are often also seen on CAT scans, but usually we end up getting an MRI scan to diagnose it.
So we prefer gamma knife. I think that's probably our first-line therapy. For certain cases where the tumor may be too close to the optic nerve or maybe encasing the optic nerve, we may consider deliver the gamma knife over a few days, kind of fractionated gamma knife. For really large tumors where we don't think we can deliver the gamma knife safely, we will have to use sort of what we call fractionated radiation therapy, which is radiation therapy delivered over approximately 5 to 5.5 weeks. And that can be delivered using two different technology, intensity modulated photon radiation therapy or state-of-the-art proton therapy. And proton therapy offers certain advantages over sort of the more standard photon radiation therapy. So sometimes we can use proton therapy for some cases. But they're considered second line when gamma knife is not possible.
If you come to Siteman Cancer Center for your pituitary tumor, you're going to be greeted by one of our Brain Tumor Center nurse navigators. And they really are the emotional glue behind this. They're going to be holding your hand and coordinating your appointments with not only neurosurgery, but with also endocrinology and ENT.
From the otolaryngology or ear, nose, and throat perspective, we have fellowship-trained physicians who specialize specifically in the nasal cavity, the sinuses, and what we call the anterior skull base. We've had added training to really perfect the techniques and care for patients with pituitary adenomas.
We will also be talking about your case in our anterior skull base and pituitary conference, which is held on a regular monthly basis. And so you'll get the expert opinion not only of one person, two people, but of 30 people in the entire center. And then we are also performing clinical trials, and a lot of these are led by the medical director of the Pituitary Center, Dr. Julie Silverstein. And these are going to be the new medicines for tomorrow. I mean, right now, really the only tumor you can reliably treat with medications is something called a prolactinoma, which spits out prolactin. So the prolactin levels in your blood are sky high. Now that has a good medicine, but all of the other pituitary tumors really don't have great medicines. And so many of the clinical trials led by Dr. Silverstein are going to change that. We also have surgically oriented trials, and specific to that is how should we optimally treat our patients after a surgery. And so there are new ways of thinking about this, and they can be as simple as drinking more or less water. And I think these will really transform the way not only we take care of patients, but the world as a whole takes care of these pituitary adenomas.